Hey, sorry about it because I'm not into computers. Sorry so much. Uh, my name is Felix. I work in a physical rehabilitation center for animals. I work in regenerative medicine and hyperbaric medicine. I will start to say, starting thank you and good morning, everyone.
Volumen, bájame
Uh,
volumen. Bájame
Thanking the
volumen.
North American Society of Human Termology for the invitation, the support of the Uruguayan Society of Medical Termology, the Andes Group, to which I belong and which is part of my research and in regenerative medicine, and Beckenham, my health center, which gives me so much satisfaction. Today, I'll give a brief, but no less important, overview of what thermography means in my professional practice, and thank you all very, very much. It is very important for me to communicate useful techniques that I have been able to use in these 26 years dedicated to physical rehabilitation, regenerative medicine, hyperbaric, and thermography, which I'm in love with. Some conditions that ensure the medical validity of the exam. It may be necessary to request a trichotomy 0.5 centimeters long 7 days before the exam. I prefer not to shave. Be careful with the inflammation of the hair follicle caused by shaving. It's prohibited clothing. If you bring it, try to ask to have it removed and wait 25 minutes just for the touch between the clothes and the skin. Number three, prohibited harness for the same situation. Number four, take a test in a suitable room with controlled external light and room temperature to avoid changes in the dermal plexuses. The next one is not outdoors. I know that this is difficult, sometimes impossible in horses, but in dogs and cats, please not outdoors to avoid changes in the plexus as well, okay? And all these patients must be at rest. That means to avoid changes in the plexuses due to vasodilatation. As with many type of images, it is necessary to have strict positions that ensure interpretation. In this slide, we can see a frontal image of two patients, probably the easiest to capture since the dog's fear is reduced by being able to meet the patient gaze with the thermologist's eye. The tutor should always be on one of the two sides, holding the patient's head ideally by the chin, without lowering their head so as not to obscure part of the pectoral muscles. Remember, always, every time, see pectoral muscles. Whether imagine arms or legs, one must be patient before shooting, waiting for the exact moment when both limbs are parallel. The next slide is images of the back structures are called dorsal images like in X-rays, require complete absence of movement just to achieve the most aligned patient possible. This is especially true for breeds with faults to minimize artifacts or to better identify artifacts. The patient in the photo is a Yorkshire Terrier. He received trichotomy, not shaved or clipped, just 7 days before the image was taken. His hair remains at its normal length on his head, as as can be seen. Shoulder alignment is observed with not false artifacts. The harness should preferably be removed 20 or 25 minutes before the image is taken, and he should obviously not wear a collar. Some people put on their pet necklace, collar or necklace out. If this is the situation, obviously. The next slide. Short-haired patients like him are so good. I mean, left patient. We can take from him the image at the same day with the initial consultation, and we can process the image at the same time, and even initiate treatment or request another type of exam based on our termological criterion. This breed, in particular, undergoes a fairly high number of spinal decompression surgeries. The left one, you can see the scar on his back, which is why we often receive some with sutures. I think my pronunciation is good for this word, sutures, or different shapes or lengths. In my experience, the suture, depending on the strength with which it's placed, can generate some pressure on the skin and consequently slightly change the dynamics of the skin's vascular plexuses. I take an image at the time of the visit, which helps me make decisions during rehabilitation, and I repeat the same image under the same environmental condition as soon as the sutures are removed. The patient on the right received selective hair removal in the area of interest following a stroke surgery. This decision was made primarily because in some breeds a haircut can alter the characteristic of the hair that grows back compared to the previous hair. It is even possible to notice some subtle color changes, which is important to some owners. This is really, really important. Uh, these are sides views also necessary, mainly elbows and knees, but as upright and still as possible, always in a thermally controlled room, without external light and with black backgrounds. This way, we avoid high bouncing back toward our sensor. This is a patient with selective hair removal. He's a patient who underwent emergency surgery for a stroke, so he has unable to walk. He has now recovered. We only need to be able to work on hyperbaria like a next step. So, the ultimate goal is to be able to measure and correlate the existence of changes in the distribution and shape of vascularization near relatively close to the accident area, and at the same time to be able to target tissues with a pattern similar to that of the accident with therapies such as ozone or hyperconcentrated platelet growth factors. So the result was that the patient present several peaks of hypercoloration with thermal extremes in those areas with a rather disordered pattern. The arrow, I'm looking for this one, this is the arrow. The arrow indicates the index area of the injury discovered with MRI with a pattern deviated to the right, which curiously is experienced in the thermography. In addition, all the other similar areas are observed forward and backward but always with a tendency towards the right of the patient, which correlates with the neurological symptoms. The next slide, I share the following because simply to demonstrate that the tissue changes after the suture removal. The holes, these little holes, are clearly visible, and the incision area, having been repaired, closed, and discharged, shows changes in the vascularity of the skin plexuses, even 21 days after the stitches or sutures were removed. It would be helpful to study how long it takes for this vascularity to recover, or if it ever recovers at all, or maybe to see if there are any future risk factor for skin disease or changes in surrounding cellular behavior in this type of patient. It could be helpful, I think.
Mhm.
The next slide, it shows how, thanks to thermography, we can select a treatment in orthobiophysiatry. This is my specialty. Letter B, this one, shows temperature difference and strong colors in the lumbar region of this dog, which have a positive correlation as this patient has a condition called lumbosacral instability. Letter C shows thermological changes in the pelvic tissues. There is a correlation in the right hip with hip dysplasia with X-rays, right in that area of greater radiance, the thermal deltas. But the letter A, this blue spot, marks a zone of different behavior. There are inflammatory patterns of strong colors or inflammatory thermological deltas, which suspicion of chronic low irrigation zone. So the curious thing about all this is that the patient presents spinal signs and has an history of spinal surgery right above that blue spot. So the question is regarding neuropathic patients with prior surgery. Are there any vascular sequelae from the previous repair that we should take into account and ignore in subsequent thermological analysis of this type of patient? Probably a good application of laser or ozone as an angiogenic agent can change this. Thanks to thermography, the zones could be divided and the best treatment selected. Letter C, with hip dysplasia, received autologous stem cells. A and B, because they are chronic with nuances of low irrigation, were injected with growth factors and ozone to increase vascularization. The next slide, his money. I love this dog. He has worked his entire life rescuing bodies from under rubble. As you know, I live in a country that had earthquakes maybe 1 or 2 times per week. This is so important for us. So the movement of his arms in this role, excavation movement, can become a risk factor in the future for his health. He came to the consultation with alternating lameness. Um, all clinical examinations by the other colleges were satisfactory, but, however, we were struck by the fact that the thermographic image in the area marked as R6 just in the point of the arrow showed changes in deltas compared to the surrounding tissues, closed tissues. These deltas were high, so therefore an X-ray of that segment and tendon ultrasounds were ordered. The result was that Manny present chronic tendon calcification. The owner now is in love with thermography, really. The next slide. Jim is a greyhound rescued from an accident. Unfortunately, his right hind limb was amputated before arriving at our center. They met us after the surgery when he was about to lose his left arm as part of the after effects of his wounds. Jim first received ozone therapy with the goal of increasing his angiogenesis. The X-rays clearly shows the edema distal to the injury, and the photo shows the severely damaged and infected wound. If you look at the image above, the disorder of the vascular pattern is clear. Many areas with inflammatory thermal changes surround the edematous image. This image is very useful for identifying those points where this patient needs therapy. This thermal image has a digital mirror at the bottom right of the slide. After treatment, a controlled thermography is taken. It is obvious to the naked eye that the edema not longer exists, but the usefulness is even greater when trying to find points or areas that heal slowly. As can be seen, many areas of inflammatory delta are not longer present. Talking about wounds, our term, the Euro Society is using some thermal profiles about new analysis to treatment and discover infections and areas about wounds. And I think you must ask to Dr. Professor Sergio. It would be very, very interesting. We are trying to copy him. The next slide. Jim, the same dog, at the moment, he would begin his hyperbaric session without edema, which indicates a fairly optimal recovery of his return circulation. This kind of patients could be a headache. To be concise, this is the typical patient who received cruciate ligament repair surgery, who never received rehabilitation, and after 4 years, the tutors decide that there is something they must do. Uh, under the letter A, we have the core of the knee, and under the letter B, a large area with chronic low irrigation thermal changes and very low deltas. It is really a very painful, actually, area when we touch it. So, when a patient with a significant physical history visits us, thermography can help us to discover how far reaching the lesions are, and in this case, regenerative cellular treatment of the quadricep muscle is included. Oncology. When an oncology case arrives, we can inform the oncologist about the vascular changes around the lesion. This is the case. In this case, this is an osteosarcoma, which is quite obviously located in the lower right X-ray. But if we look at the thermal image over the bone lesion, this is more proximal, we find an area of greater thermal presence with deltas that shows an increase and a strong color. I don't work in oncology, but out of respect for this type of patients, I always inform the specialist about the changes that occur in the vascularity of these tissues. Interestingly, they receive very positive information, so oncology research is needed in the near future as can be seen. This is a cinethermography. It's very useful. It can be used in a very interesting way, especially to analyze changes in the behavior of tissues subject to movement. She is Luna. She has a severe spinal cord injury. You can see the movement, not normal. However, with this type of filming, we can observe an abnormal discharge over left shoulder, observable at seconds 10, 11, and 12. We are waiting for these seconds right now, the left shoulder. The thermographic image only showed swelling over her right shoulder, which will soon be analyzed with ultrasound, but the video gave us an indication of an increase in this discharge over her left shoulder. In other words, we can go further than the objective of the initial consultation, which was the spinal cord injury, and in this way be able to rehabilitate a patient in the most complete way possible. Well, I think that's all, and I think I'm in the timing.
Okay, thanks so much, Dr. Felix. By
Oh, thank
an amazing
you.
stop share, stop share. Thanks so much for your amazing research. I think in this
What's up?
technology are
Was a very strong exercise in English for my brain, my God.
I think
I'm going to sleep to the rest of the day.
no, 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 no. This is fine. I think your research is amazing. Uh, no way. Only one way for thermology is applying complementary paraclinical studies. You share, demonstrate, then I think is the best way. I have here one question about your patient from the wounds. You talk about the use of hyperemia thermal region (HTO) from analyzed by profile. We should you want approaching use it for thermal profile for two peaks or M pattern. Do you can see then in your wounds, chronic wounds? What's your
I
experience
know,
about wounds and thermal profile? Which
I
one?
know, uh, to be honest, I'm starting to do this on wounds. I know that you work with this about, you are so professional about it, about HTO, height, hyperemic. And as we said, we are just starting follow you, but I know that this allows to analyze borders, bottoms, and the sound about and around the wound. I know that it's very useful and important to check if there is real inflammation, real infection, or hide infection. So I know I will have to start to do it. And I think I'm going to start studying this kind of procedure because I think that the most of the patients come to me with good condition of wound, but there are someone that I suspect that could be some hide infection. I know of this.
Okay, okay. Other question. You can use it, film thermography or scene thermography. Have you done useful from overcharger, sorry, about the muscles or identify patterns from your regeneration therapy? You can use it, establish area for LET, or you can use an outsiders no control runs similar to horses of Deborah Parker. I have many questions, but in cinematography, how you prepare the neighborhood from acquired this film?
With neighborhood, you mean the tutors?
Yes.
Okay. Just I have a I think my answer is we would be okay. Okay, okay. I have a small room with no windows, with a black floor, black walls to stop any light contamination.
Yes.
So the image that goes inside of my sensor is really, really poor. We are just taking pictures of the e sorry, of the oh, I forgot the word.
Decir en
Really, really
español si
sorry.
querés.
Ah,
Decir en español si querés.
sobre el rebote de imágenes en
Right,
cuanto al.
reflected in
Sorry.
radiation. Yes.
Okay, yes, that's the word.
Okay.
This is the this
Okay.
is my consideration about it. I know in horses is complicated, maybe impossible, but I don't work in horses, but I do in dogs and cats is quite good for me.
Yes, I very appreciate you now inside your films or acquired images, not your parents from your patients, because it's common. You can see workers, papers, the patients, cats or dogs. In same time, the parents is taking them, yes, in the same picture. You never these images you were sharing here never see the parents inside the same picture. Congratulations, this one. Okay.
Thank you.
Any questions from the others?
I just want to make a comment. I work on horses, and I'm new at this, Dr. Felix. So I appreciate your 26 years doing this, and your presentation was wonderful. And I do
Thank you.
challenge. I get challenged with horses. Fortunately, most of them are in barns where I can control some of the environment, but I look at my images afterwards and say, "Oh my goodness, that reflection came in from the other side of the
Yeah,
barn and I didn't notice it." And so I'm really learning, and it's difficult for the movement of the animal too, right? When you're ready
yeah,
to click that image, they move.
yeah.
Yeah, so thank you so very much. This is
No,
very interesting for me.
thank you for
Deborah,
your
I
details.
want to
Very
question.
appreciated.
I want to question for you. You can use a film thermography for analyzing the charger overcharging about the muscles or over treatment from the futures. What's your experience about that?
Oh, it's very, very good. I'm very, very happy with this technique because
No, no,
after
sorry,
the
sorry. It's for Deborah. For Deborah.
Oh,
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 sorry,
okay.
sorry.
With the horses, overuse of muscles, yes, definitely. And Dr. Marcella has been working with me to encourage me to do pre and post exercise imaging. So I'm working more towards that now to see the differences. Yeah, it's like I said, I'm new, so I need my
Okay.
veterinarians with me.
Okay. Next presentation from Deborah. We should
Oh.
Okay.
start.
I can give you all a perspective of a newbie, a
Okay.
I
new
will be
person.
there.
We're starting waiting for you. Professor
Okay.
King, go ahead.
Dr. Felix. First of all, excellent presentation
Thank you.
and also excellent English. I want to just, you said you were a little concerned about your English and it came out very, very good.
Like in
So,
Thailand, sabarika.
so my question is when you're doing monitoring of wound care, what is the frequency that you're using to evaluate? So how often are you seeing that patient to monitor the healing of the wound?
Uh,
Te preguntó
sa-
si cómo es la
no, no,
frecuencia
no.
que
Sounds this microphone.
Yes, yes. Perhaps down your volume, please, Kane.
Can
Oh,
you repeat it?
let me try that.
Can repeat it, please, for your question, please.
1 second.
Te pregunto con qué frecuencia ves a los animales que estás tratando que tienen heridas.
Ah, okay.
Translating for him, people, sorry.
Oh, thank you. Is that better with the
Okay.
microphone too? I changed my microphone settings, so hopefully that's a little better.
No, it's okay.
Much better now. Yeah.
Talking
yeah, much
talking
better.
about thermography, I start with a thermography. I'm very strict. I wait for the shave, for the removal of the hair.
Mm-hmm.
I take a second thermography just in the middle of the therapy. It would be 1 month after, and a new thermography after all the treatment. And if we need another hair removal, we are going to do it.
Right.
And after that, yes, I saw it right. And after that, I still taking thermography in every control. It is every 3 months. I so it's right. Because in this kind of patient, we work with controls every 3 months for all the rest of his life.
Excellent. Thank you. That's a good,
Thank you.
clear protocol.
I can do a question.
Oh, hello.
Hello, my friend.
He's my soulmate of my work. He's from Argentina.
Welcome, Juan Jose.
He's
Go
another
ahead.
part of Andes
Hello,
Association.
hello, everybody. Felix, you mentioned the application of hyperconcentrated plasma in one your patient. My question is whether you were able to see any immediate change at the time of application, and what was the patient evolution in the short
Yes.
time?
I think the most clear evolution that you can see on thermography after application, talking about maybe growth factor, if with thermography you can see the evolution and you can see how these muscles are appearing and growing up after every thermography. You can see more, in simple words, red colors, orange colors on this thermography. The blues, the cold colors is starting to disappear. I think this is a more important, the most clear that you can see in this evolution after maybe growth factors and stem cells. You can see maybe that the inflammation of the or maybe the deltas starting to going to be normal. after the application, but maybe after 1 or 2, and sometimes depends on the age of the patient, 3 months after the first injection of stem cells.
Okay, thank you.
Thank you to
Thank you
you.
so much.
Okay, one question about that. You can application in the site, plasma recovery, or you can use system applied.
What do you mean?
My question is about if you can see inside the right region inside you can apply plasma recovery. I think I don't know the rest here mind, but expect that more temperature inside the room hyperemia area if you can use it apply an injection. Or
You
you
mean,
applying for other side systemic applied. Understood?
can you repeat in Spanish, please?
Lo que te quise preguntar es si cuando vos aplicás el plasma es en el sitio o es a nivel sistémico. Porque si es en el sitio, yo espero que haya un aumento de temperatura por la
Yes,
propia aplicación.
just is at the area that you need to apply, not at the system of the patient. It is normal that after just really after the application, if you are saying with your thermal sensor, you can discover on most high temperature after the injection. This is normal. But if you are taking or shooting thermal images, maybe 1 per week, you can see a slow, increase of temperature.
You can use a cine thermography applying in the same time you can injection area of the right in the region of interest.
I
Have a
don't
good idea.
I don't prefer to do it because when you work with stem cells, you need that the patient takes some rest to avoid inflammation about the movement, okay, and the touch between the joint, inside the joint. This joint must be at rest maybe 1 week without anti-inflammatory drugs. The rest is very important. Maybe soft exercise could be, but I'm going to do it.
Okay. Anybody questions? Come on, Deborah.
Well, I was just curious about the emissivity. Do you standardize emissivity settings across all animals, or do you just adjust them based on factors like, don't know, coat density, skin pigmentation, and breed-specific characteristic? This question may be for Dr. Felix and also for Deborah, because I'm so curious about it, as animals are not normally my patients.
Can you repeat that? I'm so sorry.
Yeah, I was just thinking about emissivity, right? So normally
Emissivity, yeah.
Yes,
yeah.
in humans we use 0.98 or 0.95 for BDD when analyzing the face. So I was wondering for both of you if you standardize emissivity settings across all kinds of animals, or if do you just adjust them based on factors like, don't know, coat density, skin pigmentation, or breed-specific characteristics?
She's talking about emissivity, and if we use the same emissivity in every patient and every condition.
Yes. Sorry, let me just translate.
Yes, the emissivity never changes.
Yeah.
Never changes, never. You can't change the emissivity. It's always the same.
Because
I use 0.98 for horses.
Yeah,
I don't know what you use.
0.98.
Okay, because I was attending some trainings in the past, and they saw us that depending on the dog, for example, on the amount of hair, they were changing the emissivity. This is
No,
why I was
because
questioning that.
obviously, because if you change the emissivity, maybe you are taking some pictures in dark, but the emissivity is for wood, for iron, for another, not for tissues, not for alive tissues.
Well,
Hmm?
okay.
Maybe.
I see what you're getting at though, BB, because I have a
Yeah,
trouble with the different hair colors. And
exactly. I
Dr.
remember
Felix
you
showed
mentioned
that
it.
you have patterns that you see. The light hair color with a pinto, goes from black
Exactly.
to white. It's yeah. I
Yeah,
get what you're
because
saying.
I remember when you mentioned in one of our medical minutes, and I was so curious, or maybe when I was attending one of your conferences,
Uh-huh.
and I was thinking, wow, this is really interesting because, well, I have just done thermography for the dogs of my friends, but not as my patients, just in order to be able to help. So for me, it was a challenge when the dog had a lot of hair because emissivity, of course, makes a role there when taking those pictures. So now you are working with 098, Deborah.
Mhm. Yeah, and
Okay,
I keep it consistent, but you do have to make, a
I'm adjusting.
determination when
Yeah,
you look at the images that what you're looking at. Yeah.
Okay,
right.
I want to question for Deborah. Deborah, you can acquire imagings from your horses. How do you save distance for not over horses damaging you or others practitioners in the same time? How many distance from safe
hmm
security for acquiring imaging outside the room?
Yeah,
I have very good clients
talent.
that hold their horses, and that's why you see some of my clients in the pictures. Unfortunately, I have to work on that. But yes, 3 feet is what have my setting at, and so I'm trying to keep watch of that as I go through the horse because I have to sometimes move them across the room. They're in wash racks that are kind of small. So I have to make sure that I get the left side and the right side, that they're moved against something that has the same background. It's a challenge, yeah. But yeah, I try to keep it 3 feet, and that's my setting on my camera as well.
Okay, thanks so much.
Yeah.
So
Anybody?
next challenge for you, Deborah. We are just looking for also your.
Yeah, Deborah. So it's
Yeah,
the next
we just have to
presentation.
book it.
The next
Uh,
presentation, we can see you. You are working,
okay,
Deborah.
okay.
Yeah, hands up.
I'm game.
Who wants to see a presentation for Deborah? Come on, people.
Come on, Deborah. Be a rising out for Deborah.
You're gonna
It's okay.
torture the newbie.
Okay. Anybody other questions? Linda Harris, Jane. Hey, Jan. Hello.
Good afternoon, Jan. Oh, I think maybe she's on mute. Well, I just would like to congratulate Dr. Felix for your interesting presentation. As at least for me, this is not my normal patient, so it's great to see how we can apply thermography on your environment. So thanks for sharing that.
Thank you so much to everyone.
Thanks so much, Felix. Your frontiers from the thermography is never touched the sky. I think it is very nice. I expected from the next presentation from Dr. Deborah.
Yes,
Perhaps the
I
next
will be there.
Let's book in
next
it.
next Saturday, Deborah. Are you okay next Saturday? What you think about it?
Yes, yes.
What would you like to hear about? Let me ask you that first.
Okay. No
Surprise
problem.
us.
Yeah.
Some
Surprise
what?
us. Deborah, just surprise us. I'm sure that
Okay.
whenever you present,
Okay.
it will
I'm
be
game.
new
I'll
for
do
us.
it next Saturday.
Next
All right.
Saturday. Thanks so much, Deborah. Thanks. Okay,
I
loving it.
promise.
Okay.
Okay, for
Thank you,
everybody.
Dr. Felix. Thank you
Thank
very
you,
much.
sweet.
It was very good for me. Thank you.
Thank you to you.
Let me just remind the people that well, I think that there's no one new here, but we just invite all of them to visit the website of American Academy of Thermology in order to become a member, and also to visit our Spotify podcast.
Thanks so much, baby.
Thank you.
Professor Kane, you can close the clinical unit today, please. Go ahead.
Sure. Sure. I'd like to thank everybody for coming, taking some time out of your day so we can all learn and grow together. Dr. Felix, thank you again so much for your presentation and all the work that you're doing and your willingness to share with us. These medical minutes are so that we can all learn together, continue to grow the profession, and continue to help our patients as best as possible. So we look forward to seeing everybody again. And thank you, Sergio, for hosting. And we'll see you next week with Deborah's presentation.
Thank you so much.
Thank you, everyone.
Thanks so much for everyone. Bye-bye. Good
Bye-bye.
Saturday.
Weekend,
See
everyone.
you soon.
Bye-bye.
Bye-bye.
Muy bien, Sergio. Perfecto. Ah, estás muteado.
¿No fue muy bien?
Para la grabación.
Sí. Sí.